Hello everyone and welcome to today's episode of Obesity Management, Prevention, Treatment and Long-Term Care. I'm your host Tala, and today we're diving deep into the topic of obesity and the challenges faced by patients with obesity. We're joined by an expert in the field, Dr. Sara Suliman, who specializes in endocrinology, diabetes and obesity management. She's also chair of the MENA World Obesity Federation Working Group, soon to be MENA Obesity Society. She's here to provide us with insights into obesity prevention and the role of healthcare and advice for anyone looking to improve their health. Dr. Sara, thank you so much for joining us.
Thank you so much, Tala, for having me.
So let's start with a very big question here. The first question that everyone wants to know. Can obesity be prevented?
So that's an excellent question. Obesity is a disease. Like any other disease, prevention plays a role in preventing its progression, but actually, once the disease is established, it needs treatment. So, for example, many lifestyle changes improve health, they improve wellness, but also improve weight in people who are overweight, maybe with class 1 obesity. But actually, once established obesity is there and its complications, diabetes, high blood pressure, then we need to look more at treatment and long-term maintenance.
Thank you, doctor. And what about genetics? What role do they play?
Yes, genetics plays a key role in obesity. Historically, thousands of years ago, we were all hunter-gatherers. So the people who survived were people who were able to store the food that they eat for a long while. Genetics doesn't change for thousands of years, and therefore we all are hardwired to store food. The environment has changed so that readily available food of high calorific value now predisposes people to obesity. 1 in 7 people in the world live with obesity. So undoubtedly, genetics is a problem. And we see that the countries that have the highest rates of obesity are those that have a smaller genetic pool. And one more thing to prove that genetics is key, heritability of obesity, which means if your parents have obesity, how likely are you to get it, rather than a particular gene, is very high. It's about 80%. The only trait that's higher than that is how tall or short you are. And children who are adopted in their obesity phenotype look more like their biological parents than their adoptive parents, despite the environment being different.
That's very informative. What about the statistics? What are we looking at 10, 15 years from now in this region in particular?
Sure. So as we spoke, there are 1 billion people living with obesity in the world today. It is projected that this will increase further by about 40% in the next 10 years. So scary numbers. In our region, there are very high rates of obesity. So for example, for women living with obesity, 14 of the top 20 countries are within our region. If we look a bit further at the next generation, 10 of the countries within the MENA region will have over 1 million children living with obesity by 2035. So it's a scary number.
That's very alarming. So when do patients come and consult with you? At what stage do you believe?
So one of the concerning things about obesity is because historically it had been perceived, and still now is perceived, as a lifestyle choice. There's a lot of stigma around it, and the average person who comes to seek advice for obesity or treatment for obesity has suffered for at least 6 years before they go for a consultation. Part of the issue is self-stigma. 80% of people believe that it is their problem, that they have eaten the wrong food, that they haven't exercised. Their families have similar views, their colleagues at work, their friends, and therefore it's very difficult for a person to break through that, to seek help. Unfortunately, or fortunately maybe, that is changing. There's more education of the humans in general, but more education of the healthcare workers, because unfortunately 2/3 of healthcare workers, be it physicians or nurses, believe that it is a lifestyle choice, which is quite depressing.
And speaking of stigma, how do you help your patients overcome it? Like, I imagine it affects a lot weight management.
Sure. So stigma is a major challenge. One of the ways, or the main way, is education. Educating patients, educating the whole society, educating healthcare workers. And one of the ways I use to make it simpler is, if I had a Ferrari and I drove at speed, and the cars stopped, I would brake and I would be fine. However, if I had a 20-year-old car that was not a Ferrari and I drove at the same speed, the likelihood is I would run into trouble if the cars in front of me stopped. And that's very similar to people living with obesity. Their friend might be able to drink fizzy drinks 6 times a week because their body doesn't really store very much. However, for them, if they drove at a better speed, that car could survive another 50 years. And similarly, if they improve their lifestyle, not because they done anything wrong, it's just what their body's able to tolerate. I think that works for most people. They understand it's not their fault, but they also commit to trying to improve things, knowing that it's not their fault.
For those listening today to this podcast, what advice would you give them for like gaining health and maybe losing weight?
So that is the direction that everyone is taking, particularly the World Obesity Federation. For exactly the same weight, the same kilograms or the same body mass index, one person might have quite severe obesity, so associated with high blood pressure, high cholesterol. Even with a body mass index of 27, 28, they can develop diabetes, whereas a bodybuilder might have a body mass index of 35 and be completely healthy. So rather than just going on a weight number or a body mass index number, we're now classifying obesity according to different classifications, such as the Edmonton staging system, which takes in the mental effects, the physical effects, and the mechanical effects, the knee pain, the back pain, the sleep apnea. That helps us classify patients, but it also helps us provide them the appropriate treatment.
And how would you say is gaining health different from losing weight?
So gaining health means even by losing 5% of body weight, they're able to improve their blood pressure by losing 15% of their weight. That's reducing their risk of having a heart attack, reducing their risk of cancer. So that's why the focus has changed. For most people, if I say your ideal weight is 60 kilograms and you need to lose 60 kilograms, that's effectively saying to them, you're never going to win. Whereas if you say, if you're able to lose a few kilograms, your health will improve hugely, and it does, then it helps them remain engaged, seek treatment, and have the treatment.
We spoke about gaining health, but what about losing weight and specifically? Can you elaborate a bit more about this?
Sure. So with losing weight, there's been a huge upturn of the very slim look, if you like. A lot of people target losing weight rather than, even if they're completely healthy. So we see, for example, that many younger ladies will seek a body mass index of 18 or even less, and will even seek medication to achieve that. That is a very disturbing trend because it exposes them to risks that are unnecessary, but also they are part of this stigma cycle where they truly believe that they need to be reed thin, a size 0.
Don't we all? I think we all want to be at some point.
But that it's not related to health, and that is not the conversation that we would encourage, because there are also health risks associated with excessive weight loss.
Definitely. Thank you so much, doctor. Referring to weight loss medications per se, what advice would you give those who just take these pills, even though they have like a BMI, a normal BMI, but they just want to lose 4 to 5 kilograms, let's say? What advice would you tell them, or what insights do you have on this?
So in recent years, there's been a sharp increase in weight management medications, or I will change that to obesity management medications, which are successful in weight management. As a result, there has been, I would call it, abuse of that. There is no other disease where people will go to their local pharmacist to get a medication without consulting with their physician, maybe getting advice from a neighbor or a friend or a work colleague. For any medication, even the simplest headache medication, there are side effects. And what a physician is trained to do is to balance risks and benefits. And therefore, with supervision, appropriate people will get treatment for health gain rather than just weight loss. What's happening at the moment is there's been a craze about weight loss medications where people will use them and sometimes they're very safe medications on the whole, but sometimes get side effects which are unacceptable for a young, healthy person. I think the other issue we've had is because there's been abuse of these medications. There's been a problem with supply for people who genuinely need it through 2022, 23, and even the first quarter of 2024. So I think regulation has come in most parts of the world and will come in. It is very important to ensure that the appropriate people use it with the appropriate supervision.
So speaking of awareness and prevention, what initiatives do you think this region is coming up with to help that?
So we're part of a big region, but we're very lucky in Abu Dhabi particularly to be in a situation where since 2008 there have been standards of care for obesity. There's been a lot of work going on in the background, both on prevention and on treatment. There are school programs. Where there is screening and identification of children and then referring them. There are programs for adults. There are programs whereby general practitioners or family physicians can identify patients and start them on the pathway. There's a huge obesity committee within the Department of Health and an obesity squad, which has scientific arms that are aimed at lifestyle, so regulation of sugar sweetened beverages, for example, and others. But there is a lot happening. Speaking about the wider MENA region, different countries have different abilities, but the beauty of having an obesity society is to try and replicate all the good things that were done in countries which are higher income, in countries that are less able to do the trials and find out what's successful.
That wraps up today's episode. Thank you again, Dr. Sara Suliman, for sharing your expertise on obesity prevention and the importance of early intervention. For our listeners, remember, please, health is a journey, and seeking help is a powerful step in the right direction. Until next time, stay healthy and be kind for yourself.
Thank you very much for having me and for your interest in obesity.
Thank you so much, Dr. Sara. This episode was sponsored by Novo Nordisk to help us understand more about our management of obesity, prevention, treatment, and long-term care. Since we are approaching the end of this episode, Novo Nordisk has created an online HCP locator website to support patients living with obesity to locate the nearest physician according to specialty, to discuss your weight and annual screening for risk factors. And I encourage all healthcare professionals to have open conversations with patients living with obesity proactively.